be mine. Gold we have, diamonds be mine. Yet we fight, we cover it all in blood. Tell me why we wallow in the mud. Africa, 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 yeah. Mama Africa, we cry for peace. Africa.
Hi, you are welcome to the Kidney Consult Educational Series. My name is Dr. Elliot Koranteng Tannor. I'm a physician specialist and a nephrologist at the Komfo-Anokye Teaching Hospital. You're welcome. Today we are going to discuss how to prevent kidney disease. In fact, I've had a lot of calls on, Doc, you keep stressing us, you keep scaring us that kidney disease is common and that we need to prevent it, and that if we don't prevent it, we'll get end stage. Indeed, how do we prevent kidney disease? So this video is actually dedicated to the caller who decided to let us discuss how to prevent kidney diseases, and thank you very much for your suggestion. Like I said, screening kidney disease is very common, and indeed typically it will present without symptoms. I use the example of the mobile phone and how the battery runs down. If you didn't watch how to screen and all, please watch our previous videos to enlighten yourself. Today we are discussing how to prevent kidney disease. Prevention of kidney disease starts by you assessing your own risk. What do I mean by that? As you listen to me now, look at yourself. Are you at risk of kidney disease in the first place? And trust me, if you are black, you are older than 30 years, and you live in Ghana, you've taken herbal medication before, you've taken painkillers or medications before, probably you are at risk. We are all at risk. I am at risk, you are at risk, by virtue of even our color alone. Studies have it that the darker you are, in terms of blacks, are at high risk of kidney disease than Caucasians. That is it, and that's the truth. So if you are listening to me and you are even black and you are older than 30, you are at risk. More so, your risk increases, like I've mentioned in other videos, if you have diabetes, hypertension and all. So assess your risk is very important. 2, after you've assessed your risk and you realize that you are at high risk of kidney disease, I suggest that you look for ways to prevent it. How do you prevent it? If you identified any of the common risk factors that I talked about, what are the risk factors I talked about? Hypertension, diabetes, kidney disease previously, a family history of diabetes, hypertension, then you need to make sure you control them. I've had patients come to my consulting room, Doc, we've had hypertension, or I've had hypertension for the past 30 years. I always visit my doctor, but I still have developed kidney disease. And the key is that it's not just enough to visit your doctor. It's not just enough to take your medications or your injections. You need to ensure that your sugar is controlled. If your sugar is not controlled, I'm afraid you will still have the risk of kidney disease. If your hypertension is not controlled, and indeed, as I speak about hypertension, I'll make it very clear. Taking medications is not just enough. You need to take your medications and ensure that your blood pressure is always lower than 140/90. In fact, better still, around 120/80. That is what we prefer currently. Let's keep our blood pressures controlled. If you are watching me, you've checked your blood pressure and it's high, you are at risk. Ensure that you bring the blood pressures now. For hypertension, one key message is that make sure you reduce your salt intake. We have noted that amongst blacks, we take a lot of salt, and this salt is what increases our risk of hypertension. So please, please, please bring down your hypertension by ensuring that you cut down on your salt intake. Now, if you've identified the risk, control them. The other things you need to do is make sure you are eating healthy. Have you drank water this morning? Or you are waiting probably to close a lecture or close whatever before you drink water? Water, like my daughter will say, is life. Water is life. Indeed, water is very healthy for the kidney. At least each day, make sure you are drinking about 2.5. If you have those big Baltic bottles, if you have any of those bottles, that sachet water that we know of, At least the sachet water is about 500, right? So in a day, you should probably be drinking about 5 of those, about 2.5. If the weather is hot, like you have in the Hamatan, you probably may end up drinking even more. Indeed, the more you drink, the better it is for your kidney. If your urine is too concentrated, what it means is that you are putting your kidney under a lot of stress. You drink more water, you free it to work well, and by so doing, you prevent it from developing kidney disease in the nearest future. So drink a lot of water, because water is life. Do you exercise? Most of us now don't exercise. We come, sit in our cars, sit in our offices, sit in our air-conditioned offices. In fact, we go back, we drive back, sit in our halls, watch television, we sit, eat, and then we go to bed. This lifestyle is not good for your heart, it's not good for the brain, it's not good for the kidneys also. Indeed, when you have this kind of sedentary lifestyle, human beings were not created to be sitters. We were created to hunt. But nowadays, our culture, our lifestyle has made it such that we don't hunt anymore. We just make money and we enjoy our money and we keep on becoming big. Our bellies become big, and then by becoming obese, we stress our kidney. The example I always give is that if you were made to be this big and you probably have a kidney that is supposed to help you in terms of your size, if you double your size, your kidneys don't grow any bigger to be able to service you. And that is why, with time, it gets tired. When it gets tired, it runs into trouble. Obesity is a problem. What do I advise? Please exercise. Please exercise. Walk more, sweat more, exercise more, sit less. It's good for your kidney and it will prevent you from getting kidney disease. Likewise, what are we eating? I've mentioned the issue of salt intake. Too much salt is not good for your kidney because it gives you hypertension, which will affect your kidneys. Likewise, if you are eating a lot of fatty diet, if you are eating a lot of protein diet, and probably not taking too much fruits and vegetables, you are causing a lot of havoc to your body generally, and indeed affecting your kidneys. Again, do you abuse painkillers? If you have a pain somewhere, the simple painkiller that is good for you is paracetamol. Yes, paracetamol is one of the safest painkillers you can ever take for it. Better still, see your doctor for advice on how to treat that pain. That pain you are suffering might be a reason for which there's something underlying your doctor will pick. Don't go about moving from one drugstore to another just taking pain medications. If you do that, you harm your kidneys. In fact, when you have most of these pain medications with all those muscles drawn on them, be careful. They would help the pain go away, trust me. But in any case, they give you a lot of problems to your kidneys. So be worried. Herbal medication. I have all sort of eyes looking at me that, look at you. You are just saying anything. You probably may have taken herbal medication yourself. The key is that yes, some might be good, but some of them might be harmful to the kidneys. Indeed, when you take these herbal medications for a long period of time, they destroy your kidneys. Are you waiting for evidence to show that it is so? You probably might run too late. The point is that most of these medications are very potent and we buy them because of what they do for us. You may have this girl you want to service. You go and buy this aphrodisiac. Yes, you can sleep with 3, 4, 5 girls. Yes, ask yourself, after you finish having sex with all these ladies, they go home. The medication you have given to give yourself that manpower, how does it get out of your body? If it is getting out through your kidneys, trust me, it is causing some harm to your kidneys. If you keep taking them over a long period of time, it will cause a lot of havoc. All these medications that are being thrown out there as being helpful for the body, ask yourself one question. After they've done what they are doing, how does it get out of the body? And does it destroy the kidney as it gets out of the body? If it does, then please be wary of these medications. Why I am confident to say that is because even our own medications we give to you in the hospital, there are some that are hazardous to the kidneys. So at a point, if your kidney function has reduced, we tell you, don't take this or don't take that, because if you take it, it will make your kidney function worse. The question I ask most of these herbal preparations is that as you are taking it, have you assessed yourself to know how well your kidneys are in the first place and to know whether it's going to cause more havoc to the kidneys? If you haven't, then please be cautious about herbal medications because it could harm your kidneys some more. Now, if you have done all these things, what I advocate is that at least once a while, see where you are in terms of the level of your kidney function. If it is reducing, see your doctor. He will refer you to a nephrologist who will manage you adequately so your kidneys will last you a lifetime. The cost of management of kidney disease is enormous. I would, in subsequent videos, just give you a glimpse of how much it costs to be a kidney patient. And trust me, I wouldn't want you to be one. Take very good care of your kidneys. Exercise, eat healthily, assess your own risk, exercise and make sure you are eating appropriate diet, and make sure you once a while check your kidney functions. If you do that, you will prevent yourself from getting kidney disease. If you have any questions on any things of these things I have said, if you have any suggestions, if you have any topics you want us to throw more light on, if I said something you want me to throw more light on, you can always contact us. Our contacts are down the screen. Please ensure you talk to us. We want to hear from you. We want to hear the impact these videos are making in your life. Thank you very much. Your kidneys' health is your responsibility. Thank you.
The land is good, the land is fine. Gold we have, diamonds we mine. Yet we fight, we cover